Okay, this morning we're going to be demonstrating how to do a straight catheter. On the Foley catheter, we did that on a female, and the straight catheter we're going to be demonstrating on a male this morning. But as far as the technique, as far as putting the catheter in a female, would be the same as it would be on the Foley catheter. So what I'm going to do first is I'm going to go to the nurse's station, open up my chart. I'm going to be looking at my patient, and I've got Brad Taylor, date of birth 4/24/1991. Dr. Potter is his physician. He is not allergic to any kind of medications. Having difficulty with urinating, but also we need to get a specimen, and so to get a sterile specimen, we're going to go ahead and do a straight cath. So I'm going to check my doctor's orders. So I have Brad Taylor, again, date of birth 4/24/1991, no known drug allergies. And here it says to insert a straight catheter and obtain a urine sample for UA-CNS, okay? So I've checked my doctor's orders. I'm going to check my chart for any information I need to know about my patient. Specifically, we don't have any allergies, but does my patient have any problems with positioning? Is my patient able to cooperate with me? And if I'm looking to see if I need to have any PPE on in case for this patient. But this patient is not on any kind of specific isolation. I'm also going to be looking at the policy and procedure, checking to see, specifically the technique, and then if there's anything about, with a male, sometimes it may be difficult to put a Foley catheter in, maybe because of an enlarged prostate. And so how many attempts can I do before I would need to stop and call the physician, let the healthcare team know, and then we would let the doctor know. That would be an abnormal thing that we would be unexpected that we potentially could have here. So done all of that. I'm going to check to see what my patient's learning needs are. How am I going to be teaching, giving instructions to this patient? And then I'm going to go to the supply room, and I'm going to be gathering my supplies, and we'll go to the supply room here in just a second. And with any procedure, we want to make sure that we have good lighting when we go in. So we'll always make sure we have that when we get into the room. So with that, I'm going to go ahead and close my computer down at the nurse's station, and I'm going to go to the supply room. And in the supply room, I'm going to make sure I get my kit, okay? And so this is pre-connected urethral catheterization tray and bag. So that means that there's a bag in here connected to the tubing, so that's where the urine will collect. And then I'll need to get, since I'm doing a UA-CNS, I will collect the specimen from the bag once I've gotten that procedure over. And so this will tells me the type. It also tells me that this is a 14 French urethral catheter. That's the size of the catheter. And then this is a Medline, like I said, pre-connected urethral catheterization, so that's the type that I have here. So the size is 14 French. It's also going to tell me that it's got gloves. Typically in these packages, they're medium gloves, so if you are not a medium, you do need to get different glove sizes. So if you're small or a large or extra large, you would need to have some extra gloves in there, or just take one extra in case you contaminate the gloves that are in here. So just always having extra gloves. So I'm making sure that my package is intact, that the expiration date on here is 7/28/2026, and so it's good. Making sure my package is intact, because that also guarantees the sterility of it. And so I've got my extra size gloves just in case, and this says sterile unless packages damaged or open, and so this also has an expiration date on it, and so I'm making sure that all the expiration dates are good on there. Now, your kits will come with iodine betadine swabs in here, so you will need to go to your lab director and get those switched out. So your kit will be open just enough for you to take out the swabs and put the swabs that are actually you can use on the mannequins, because you will be touching the mannequins with this. So just know you'll have to switch that out in your kits before you get started, okay? So I've identified what's all in my content, make sure I had everything. This also, since I'm doing a specimen, it does say it has a specimen container with a lid and label, okay? I would get the lab requisition from the chart, which will have the patient's name and all the identifiers on there. It should have the order on there, but I will need to make sure I put, when I take the specimen, the date and the time that I did that, and my initials on there. Okay, so we've got that. I also have a washcloth to do pericure, or I've also got the supplies that the hospital provides. Usually these are kept in a warmer, so it's nice for the patient. I have my biohazardous bag to go along with my specimen. And then I've got my blue pad, got a couple of them here underneath, absorbent pad to use with the patient. So once I get all of that, and I've identified I've got everything I need, everything's intact, everything I need is sterile, then I'm going to go ahead and go to the patient's room. Knock, knock, knock. I'm going to set my stuff down on a tray. Good morning, my name is Jan Buckskemper. Of course, you would wash your hands as you're coming into the room. Actually have to do that. So good morning, yes, my name is Jan Buckskemper. I'm a registered nurse. You would identify yourself as a student nurse from South Plains College ADN program. And so let me pull up my computer real quick. Okay. And can you tell me your name and date of birth? Brad Taylor, date of birth 4/24. Okay, let's start that over. Brad Taylor, okay. 4/24/1991. Okay, and I've got Brad Taylor, date of birth 4/24/1991. Now, Mr. Taylor, are you allergic to any kind of medications? No, you don't have any allergies to any medications. Okay. Now, do you have any allergies to any cleaning antiseptics or anything like that? Okay, so our kit has iodine in here for cleaning, or betadine. Are you allergic to any one of those? Okay. No? Okay. Shellfish? Okay. Not any of that as well. Okay. So we're not going to be using, and this is, you don't have any allergies, because this is no allergies to latex, which we don't use latex in the hospital anymore. Okay. So I'm going to go ahead and put the bed to a good working height. I want to make sure that I provide for privacy. And so what we're going to do, let me get my trash down here, is the doctor has instructed us, he has ordered us to do, put a straight cath into your bladder. So we're going to do some care down in the perineal area, and then I'm going to put a catheter in there. It may feel a little uncomfortable, but what we're going to do is we're going to drain it into a bag, and then afterwards I'm going to take a specimen from that bag so we can send it down to see if you have any infection, and if you do, what kind of infection, so the doctor knows what antibiotic to put you on, okay, based on that. So when I get ready to do that, I'll have you take a slow, deep breath, okay, and let you know to take a deep breath, and then we'll do that, and then as soon as we drain all that, the urine out of your bladder, okay, then we're going to just take it out slowly, all right, and then we're going to put do a little bit more pericare for you, all right. Okay, so again, privacy. Got the bed in a good working position. I've got good lighting. I'm going to put my gloves on. Washed my hands when I came in the room. So I'm going to need to position you. Did you have any questions with what I was telling you we were gonna be doing? Okay, all right, so move this out of the way just a little bit. All right. Got our privacy. Move my trash bag up here just a little bit. Okay, so I'm going to need you to go ahead and spread your legs as far as you can, okay? And we're going to go ahead and expose you. Okay, so we talked about the perineal care for a female in the Foley catheter. Also kind of did a little bit about it, about the male pericare. Okay, so I need you to bend this knee, and if you'll lift your hips up, we're just going to get that blue pad up underneath you. Okay, and now I'm going to go ahead and do a little pericare on you. These are warmed up. I'm going to move these off to the side here. We'll be needing those. I'll get you some fresh ones. Okay, so with this, if our male was uncircumcised, okay, we would pull that foreskin back. Okay, that foreskin comes back to the glands here. And we're going to take our first washcloth and we're going to start at the meatus and we're going to work in a circular motion to the glands, okay? And then I'm going to get another one. I'm going to have to get you some new ones here in just a little bit. So I'm going to kind of fold this in half. So on this side, we're going to work, we're going to do all four sides. We're going to work from the glands, from the distal to the proximal, back towards the body. I'm going to change that, work back, throw that away. And then we're going to do the same thing with this one. Okay, we're going to go down the back side, then we're going to change sides, and we're going to work from the side. So 4 sides of the penis. You want to use firm strokes. Okay, so once we've done the pericare, we're going to go ahead and take these gloves off, glove to glove, skin to skin. I'm going to put these back over here since I took my gloves off. You always want to wash your hands. And we're going to set up our field. I don't need those right now. Alright, so I want to make sure my tray is at waist level or right here at a good working so that I'm not going to be dropping my hands. I'm going to just pull that, get that bed up just a little bit more. That's because I was touching a bunch of stuff. Go ahead and get my hands washed again. Okay, so I've already checked my supplies. And we're going to remove our package. Okay. I'm going to use this. I'm going to put that over on my computer as well, so I'll use that to help me with my documentation. And so you want to always open away. Making sure you're just touching in that 1-inch border. You want to make sure that the package is not, or the drape is not folding back on itself. Okay. And just know that I've got a 1-inch border around here. Anything that's off the edge of the tray, just like with asepsis, is not sterile anymore. Okay, so I'm just going to double check where I can reach in without reaching over. So if I reach in right here to get my gloves, then I know that I can't touch that part with my sterile gloves. So I'm going to go ahead and reach in and get my gloves. Okay? I'm going to put those off to the side. And since everything else is right there, I'm going to go ahead and get my gloves on. So I'm going to put that off over here to the side. Now as I step back over here, I want to make sure that I keep my sterile field in my line of vision at all times. So with these gloves, and it tells you that right here it says the thumb is out, okay? So I'm just using my finger underneath there to kind of help. And when I open this up, it'll stay open. You want to make sure that that package doesn't fold back on itself, okay? And your gloves should be in there like this. So I'm going to go ahead and reach over here and I'm going to pick up I could do it with either hand. This is the part of the glove that's going to go next to my skin. So you saw that I could move it back and forth. I'll open that up, slide, go ahead and get my fingers spread. I'm going to get that in there. Just touching on that part, I'm going to work. Okay, once I let go, you don't want to go back to the cuff. You've got a 1-inch border now. Now I'm sterile to sterile, sterile over sterile, sterile to sterile. So I'm going to pick this glove up if you don't want it to move around, okay? Now I did notice that when I opened this, I did go over that, but I changed so I know that I can't touch with that with my sterile gloves. Okay, so once I've got my fingers underneath the cuff, you want to make sure you have your glove thumb up at all times. Okay, you want to check to make sure the fingers are good below. That's why it's important that you have the right size gloves on. So I'm going to check the integrity. The integrity is fine. And so now I'm going to go ahead and reach in, knowing that I touched that part right there. I'm going to go ahead and just turn my tray around so I don't worry about touching that. So this part over here, pull that up. Okay. The impervious side, so the blue side goes up. Okay. I'm sterile to sterile here. I'm just kind of getting it where it won't fold up on me. Okay. And I want to make sure this whole time that I'm not crossing over my field, but that I'm keeping my sterile field in my sterile side. Now that's fine. I can adapt that here in just a little bit. Again, I'm going to go ahead and get my fenestrative drape. Some people don't use the fenestrative drape, but I'm going to show you how to use the fenestrative drape. Okay, making sure it's not touching anything. We're going to come over and we're just going to lay that on top. So don't worry about it right now. I'll fix it whenever I get ready to start my procedure. Okay, so we are going to be getting a specimen. Now, I'm known to be the T-Rex, so that means my elbows are at my waist, because if you start reaching over, then you're probably going to be reaching over your field. So I'm going to go ahead and just take the lid and the cup. So we need a specimen, so we need to make sure we have a sterile cup. So what needs to be sterile is the inside, okay? So the inside of my cup has to stay sterile. So I'm just going to go ahead and put this over here on my glove package. Now make sure you have your hands up here high so that when you put it down, there's no way your gloves come in contact with the package, okay? And so I'm going to come back over here. Now, when I get ready to do my procedure, I can turn my back because the lid is on the cup, okay? And the inside's what we need. So this is my label. Now, I will have the requisition that has the label and everything with it from the computer, has a patient's name and date of birth and information about it. Okay, so remember I turned that so I don't have to worry about reaching in over here. Make sure your hands stay above your waist. Okay, I'm going to go ahead and I'm not reaching across, so glove, sterile over sterile, sterile to sterile, okay? I'm just going to slide that back in there right there. And my package is moving around, but I'm still just right here, okay? And we've already checked for allergies. The package said it was iodine or betadine, and we'd already asked our patient about the allergies or shellfish. So I'm going to go ahead and, again, because sterile technique, when you have your sterile gloves on, you got to keep them in your line of sight, so not dropping them down below our waist. Okay, so I've got everything ready, so I'm going to go ahead and take this. Just going to move that out of the way, get my trash over here, and I'm going to set this down, okay? Making sure that when I do, that the 1-inch border around my field doesn't come in contact, okay? Now, I'm going to designate, now you see that it is on the 1-inch border down below, but what has to stay sterile is inside my container, okay? All right, so with this hand, my non-dominant hand, I'm going to go ahead and just push these drapes down, okay? And then I'm going to grab my penis, okay? And we're going to pull it up. And now I'm going to get my first, making sure my gloves do not come in contact with that drape. Bring it up. We're going to start at the meatus, and we're going to work towards the glands. We're going to bring it out, and we're going to drop it. You see I kind of step back so that my hand is still within my view, and I'm not going down below my waist here, okay? Okay, so again, start at the meatus. We're going to step back, drop. Okay, we're going to start the meatus. We're going to work around to the glands, and we're going to step back, drop. Okay, so that part is over with. Now I'm going to go reach in, and I'm going to get my lubricated catheter. Okay. Now when I start inserting this, I don't want my sterile hand coming in contact with the patient. So I'm going to hold it so that I've got control. Okay, so on the count of 3, I want you to take a deep breath, and I'm going to go ahead and insert it. It may just be a little uncomfortable. Okay, 1, 2, 3, take a deep breath. We're going to insert it. Now on a female, remember, and I've got a lot of lubricant on here, so you don't want to let loose of my hand here as I put it in. On a female, 2 to 3 inches, but on a male, you're going to have to go 7, 8, 9 inches. But so once I do see urine, okay, so I see urine, okay, just a little bit further, then I need to hold it in place, because otherwise it's going to slide out, okay? And so I'm going to go ahead and let this fill up. Okay, so it's filling. May need to help it if I need to. Now the sterile part is over, okay, because what I needed to maintain sterile was the catheter. But this is not going to be in there. If for some reason it started to slide out, you've got to make sure you hold that in place. You cannot reinsert it once you start. Okay, so once I've got my urine out, and then I'm going to slowly take a deep breath. We're going to slowly, and if there's any extra urine, we stop, okay? And we're just going to go ahead and continue to take that out. We're going to drain that into our bag. This is a clamp, so I'm going to clamp it. Okay? So this has got urine in it. I'm going to go ahead and put that back in there for right now. And I'm going to go ahead and take this, and I'm going to place it over there. And I'm going to get all of this part of my supplies, put that in the trash. Now I've got stuff all over my gloves, so I'm going to go ahead and do glove to glove, skin to skin. And I'm going to do a medical hand wash. Of course, your medical hand wash is on the wall, And as long as your patient's, and just going right there, you're fine with the bed. Okay? Rub that in till it's good. Put on some clean gloves. Now this time your hands are getting sticky. Okay, so here you can just state that you did pericare. Okay, so we would do pericare. Now the most important thing, once we've done the pericare on a male, you have to get that foreskin back into its natural position, okay? So we've done our pericare, okay, all four sides. We've got to get that foreskin back into place. Okay, otherwise, and I'll explain that in just a minute. So we've got that in place. We want to get this out from underneath our patient. We're going to, and it's clean, so we're going to go ahead and, I didn't touch the, so I'm going to go ahead and get my patient covered up. Oop. Okay, I'm going to go ahead and gloves, skin to skin. If you felt like you needed to clean or change gloves between, but we were good with doing that. All right, I'm gonna go ahead and get my bed back down. So my two side rails are up, bed's lowest, wheels are locked, my call light's within reach, okay? And now I need to get my specimen. So I'll go ahead and get my gloves on. Now, if my patient, if we were doing a residual, because the patient is unable to void or not emptying their bladder completely, then before I started the straight cath, I would have had my patient go to the back, and this would be after they've already done a bladder scan, and we're still needing to check. I would have the patient void as much as they possibly could, palpate the bladder, okay, which is right above the suprapubic area, to see if I can feel the bladder, and then we would do the straight cath, and then afterwards we would measure how much was left in the bladder after they went to the bathroom, and we would document that, okay? But I need to get my specimen here. So I don't need that one right now. Okay, so I need to make sure that I keep this cup. So I'm gonna go ahead and take the lid off. I need to make sure that I don't cross over the lid or the cup, and I don't turn my back on there. So I'm gonna go ahead and get my catheter, and I've got my urine in here, okay? And so I've got it clamped right now, so I'm gonna go ahead and, without touching that, I'm gonna go ahead and undo it, and then I'm going to put it over my, and then unclamp it. We're gonna get however much we need, which is typically about 30 mils, okay? Once I've clamped it again here, I'm going to lock it, okay? I'm going to put that back in here. I'm going to get my lid without crossing over. And we're going to put our label on there. Now on the label, it will already have the patients, the two patient identifiers. It will have the order as to what we're needing for the requisition, but I need to put the date and the time and my initials, okay? So once I do that, then I'm going to go ahead and put it in my biohazardous tag, okay? Actually, before I actually do that, I'm going to go ahead and get eye level so I can Okay, and I do have 30 mils in there. Requisition will go in the side here. Now I'm going to take this and I'm going to go to the bathroom. Okay, and in the bathroom I'm going to have, and so I'm in the bathroom, and I would have this, and I'm going to go ahead and open it, hold it over it, and clamp it. Get my hand. We don't have that catheter going everywhere. Okay, and we're going to go ahead and drain everything in there. So once we've got all that drained in there, then I'm going to go ahead and get eye level. And so there's 200 in there plus the 30, so 230 is what we had. I'm going to be evaluating the color, the consistency, does it have any, and also the odor, that I can do this from this. And with all of this, we're going to go ahead, and this would be in the bathroom. We're going to put it in the bath. I'm going to take this, dump it into the commode, rinse it out, leave it in the bathroom for if we have to have anything with a male, we're still checking for his how much he's urinating. Glove to glove, skin to skin, do my medical hand wash. Okay. All right. So now I need to go back over to my computer. Okay. I'm going to pull my computer up, and I need to document. Okay. So typically on a computer, when you have computer charting, if not, you would have to do this paper, which there's been a couple of instances where hospitals lately have been having to use paper. I would make sure that I go to the spot, so whenever I click on that spot, it will actually give me the hospital will date timestamp. Okay, so we need to know the date, the time that we actually did this procedure. One of the things that we've been doing, we evaluated during the procedure, and now that we maintain sterility of our catheter, our supplies, our gloves, our specimens, so we maintain sterility of all that. If we found anything that was abnormal, which would be unexpected, the expected would be that we were able to drain and we got the urine out, the patient has comfort, and we'll send that off for the lab or the UA. But anything abnormal, we're going to document, we're going to report to our healthcare team, which includes the physician. And then, so documenting, like I said, it's going to be time stamped and date time stamped when you click on it. And so we're going to be looking at the type, okay, what type of catheter, the size, which was the 14 French, okay, the color and the consistency, which it was light yellow, it was clear, and it didn't have any odor, so we would, number of insertion attempts. On this case, we just attempted one, and that sterility was maintained during the procedure. That we obtained a specimen from the bag within 20 minutes or 15 minutes, whatever the policy is, from the bag. So if it was longer than that, we would not be able to take that specimen. Any kind of patient teaching that we did on our patient, what we did before, how they understood that, and then with any procedure, we're always going to be looking at how our patient tolerated the procedure. And so, are you doing okay? Did you have any discomfort while we did that? No. Okay, so no discomfort during that insertion. And so once we finish doing our documenting, we're going to go ahead and shut down our computer here. And Make sure our patient's in a good, comfortable position. We're gonna go ahead and make sure we have all of our supplies. We'll leave those in the patient's room. I've got a new cut and build so we can have for our patient. I'll move my trash bag, get my table where the patient can get it. Okay? Okay, so bed low position, side rails up ×2, wheels are locked, call out within reach. Is there anything else that you need? Okay? And as I walk, get ready to leave the room, I'm going to go ahead and do my medical hand wash. And I'm going to take my specimen down so we can get it sent down to the lab as soon as possible. Okay.